Good morning and welcome to Duke Spine Institute live stream spine surgery. It is Tuesday, March 4, 2025. I'm Dr. Ara Dukmajian, CEO and founder of the Duke Spine Institute. We have been live streaming spine surgery every week for the last 10 years, going on 11 years now. We've live streamed everything from spinal fusions to laminectomies, discectomies, spinal cord stimulators, endoscopic laser surgery, the newer plasma surgeries to treat joint pain. Pretty much lots and lots of different types of pain procedures for spine pain and joint pain. And we take questions during these live streams. We're streaming now on multiple platforms, including X and Facebook, LinkedIn, YouTube, and a few others. Our patient comes here from Alabama. I just met his lovely daughters. They're from Georgia. He's got neck pain and back pain, but today he wants his back fixed. I examined him yesterday, looked at his MRI. He had no sacroiliac pain, no piriformis pain, no facet pain. He only had deep axial pain right here. And I determined it was coming from 3 damaged discs. He has a 4th damaged disc, but it was above where his pain was. So we're going to operate on these 3 discs to get rid of his back pain. Henry, let's show the audience the 30 different causes of back pain.
Of course.
I'm Dr. Ara Dukmajian with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic sciatic pain down their legs with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Machen. Thanks for joining us. Welcome back. You can see from our video that there are about 30 things that cause back pain. The most important and the most common is a disc injury. Now, this patient has several disc injuries, the worst being the ones that I'm working on right now. Shot. L3-4, you can see the disc is not just injured, it's collapsed. Lots of bone spurs. You're doing great, lay still. I'm trying to get, no, he's fine. He's fine. I think he's just coming to. All right, so there's one. Now, 5-1 is extremely challenging because this patient has gigantic facet joints at 5-1. Shot? Yeah. I think the facet is pushing us lateral. Shot? AP? We're going to have to retry 5-1 on the right. So we are approaching the 3 damaged discs that are painful. 1 on the left, 2 on the right. And you can see, show them all the arthritis there that's happening at L3-S1. Shot? Yep, and that arthritis is really what's blocking me from getting into that L3-S1. So I got to try to get around it. Blood pressure's good. Yeah. Shot. So if there's questions, I'll take them while I'm trying to get us into the proper position.
Yes, this question is coming from Lanu on YouTube.
Yes, Lanu, welcome.
Asking accounting question.
Sure.
Most of the equipment you purchased are quite expensive. Yep. Do you get tax credit or tax break when filing it on tax season?
Not really. It's very hard to depreciate equipment, but you can. Shot. All right, so I'm hitting probably the iliac crest. I have to get around it, and that is what always limits L3-S1. AP, so we are good to go on the left at L3-4. I'm trying to get into 5-1, but his facet joints on the right in particular are really big. Yep. So I'm going to have to try again. I keep hitting his iliac crest. That's the problem. The iliac crest is in the way. Shot. But I am not going to give up. Shot. Not yet. We have to keep it safe for the patient. Shot. But I'm having a little trouble getting past the arthritis in the facet joint. Sean? And the facet joint is literally pushing my needle laterally to the side, which is not good. Sean? AP? Now he was on blood thinners for a while. We stopped the blood thinners, but he's lost probably about maybe 2 cc's of blood. Yeah, that's the problem. Show the facet there. Look how big it is. Just show us the facet. Okay, see all this dark material, and it's even above that. Yeah, all that is an enlarged facet joint. That is what's blocking my needle from going to the disc. Yeah, that's what I'm struggling with here. Sean? See, it's pushing us. Now, can you rotate the fluoro is off on orbit. Sean? That may be better. I think that's better, yeah. That looks better. What do you think, Jordan? You agree? Alright, so I'm a little bit lower than I want to be, Sean. Again, 5-1 is the hardest disc to get to in the lumbar spine, the hardest disc to get to endoscopically through the foramen, because it is normally easy to get to, but when you have arthritis in the facet joints, which this patient definitely has, it is very, very difficult because the facet pushes you, your needle, it pushes you away from the spine. And we need to go to the spine. And I'm trying. This is going to be my best and probably last attempt. Let's go AP.
I have a question.
Yeah.
The lower down in the spine, is that a higher risk for enlarged facet joints or arthritic?
Yeah, the lower in the spine, the higher the risk. That's looking pretty damn good. We might be able to get this. We're close. Sean? Close. Let's just see. It's going to be a millimeter that determines this. Sean, how is he? I think I'm in. I will be able to tell in a moment. Give me some dye. I'm going to use some dye to see if we're in the disc. I believe we are in the disc. The dye will help me determine if I'm inside the disc. We need to be inside the disc to proceed. Sean? It looks like we're in the disc. Sean? AP? So on the lateral view, we're in the disc. We got to get 2 views. I'm going to get an AP view as well. Give me that guide wire. Yeah, we're in the disc. You can see the dye in the disc right there. You guys see that?
Yes, we do.
Yep, perfect. All right, so at this point, is he awake? No? It's okay if he's not.
You okay?
All right.
How are you?
So I'm a little, here's the problem. His spine is extremely deep, extremely anterior. The needle is all the way at the hilt. I would have put a guide wire in, and I can put a guide wire just to make sure we don't come out with the needle accidentally and lose our position. So I'm going to put a guide wire just to hold our position. Now I'm going to make my incision, and I'm going to go for the next disc, which is L4-5. Take that. L4-5 should be a little bit easier to get to. Again, lots of arthritis in the facets. Shot. We're going to need him awake soon. Shot. Oh, that's looking good. Shot. Now his daughters came with him. He's got 2 lovely daughters. They live in Georgia. Shot. Apparently they're 30 minutes from Dad. Shot. And they're here to support him, obviously. Take care of him. AP. All right, I think we might be good here. So we'll need him awake in a moment.
How you doing, my friend? You okay? You all right?
That looks really good, actually. We should be really good. Tell me when he's fully awake. All right, folks, we're going to
Okay, my friend?
show you in just a moment we're going to do a little test on his discs. Okay, Sean, that should be in the disc. Perfect. All right, so take that. I need one more. And then, you hear that sucking? I don't know if you guys heard that. But L3-S1, if you look at the x-rays, it had, before I did the discogram, it had a light area in the middle of the disc, which was basically, we call it a vacuum space phenomena. His disc is sucking air. Comes from pretty bad degeneration. Okay, I asked him, where is your back pain? He said it's here. This is the area. All right, this is his lower back. His butt crack is right here. I tested him for SI, none. Piriformis problems, none. Facet problems, none. All of his pain was localized right here at these 3 areas where we have 3 discs. And when you look at the MRI, all 3 discs are damaged. The bottom one is called L3-S1. It's the lowest disc in the lumbar spine. The one above is L4-5. And the one above that is L3-4. So he had L3-4, L4-5, L5-S1 annular tears with degenerated discs, bone spurs, osteophytes, nerve compression. And he had another disc up here at L2-3, which was also problematic, but it was outside his pain zone. And so I offered to fix it for him, but he said no. So we're just going to fix the 3 that are really bad. I would expect him to get 90 to 95% pain relief permanently with this surgery. He'll be sore, you know, maybe overnight in his back from the surgery, but that's it. How long has he had back pain? So, you see the bubbles? Lower back pain. You're doing great, Dr. Duke here. Lower back pain for 20 years. Now, he actually came here to get his neck fixed, but he changed his mind yesterday and said, fix my back. Are you doing all right?
Yeah, he's fine. Yeah, he's waking up. Yep.
All right. Are you having any pain?
Are you having any pain right now? No.
All right, my friend. All right. Are you comfortable?
Comfortable?
What we're going to do is an evocative discogram. Evocative discogram. What that is a test to verify these discs are the cause of his pain. He's not having any pain? Zero pain, folks. Zero pain right now. He's doing great. He's just waking up from the propofol sedation. Hi. All right. So, I'm not going to tell him when I'm injecting. How bad is that on a scale of 1 to 10?
Give us a number.
How high?
1 to 10.
How high?
I couldn't hear you. Say it again.
10? I heard 10.
Okay.
Is that where you get your back pain? All right. Yes, sir. He's a good man. He's respectful. Okay, I want to show you a few things. Jordan, show them the discogram we just did. L4-5, yes. See the dye? It's black. Look at the herniation. The dye is literally wrapping around the back of the herniation right there. And that's where the nerves come out. That's why the nerves are getting pinched from the herniation. But look at the disc above. You see the dye there? I didn't inject that. Go to the front of the disc. You guys see the dye there?
Yes,
you know why that dye is there? Because when I attached the dye to the needle, it literally sucked the dye in. So what does that tell you is that there's negative pressure inside the discs when they're degenerated. We call it vacuum space phenomena. It literally sucks air. And that thing sucked not air, but it sucked dye in. All right, and then the bottom disc shows dye because we injected a little to make sure we're in the disc, just when we're not outside. Are you comfy? So we had 10 out of 10 pain at L4-5 concordant. How bad is that on a scale of 1 to 10?
Give us a number.
How high?
8.
8. Is that where you get your back pain? Is that where you get your pain?
Yes, sir.
Yes, sir. All right, sir. We're going to put you to sleep in just a moment. So 4-5, we got 10 out of 10. 5-1, we got 8 out of 10, concordant. Both of them are concordant, meaning that's his typical pain. Is it better now?
You better now? You feeling better? Yeah. Yes.
How bad is that on a scale of 1 to 10?
9.
9 out of 10 at 3-4. Is that where you get pain?
Yes, sir.
Got good news for you, my friend. When you wake up, all that pain will be gone. All right. We're going to fix his back pain because it's coming from 3 discs that are damaged, called degenerative disc disease. You guys see it on the MRI there at the bottom of your screen. We're going to fix these 3 discs right now with our laser using the endoscope to see what I'm doing. It's called an annular debridement. Duke Spine Institute was the first in the world to do this. I'm the first surgeon to do it and publish it. We published it 13 years ago. And we've been doing these surgeries now for almost 20 years. 20 years this July. Okay, if you have questions, type them up. In the meantime, we're going to get started repairing the 2 discs on the right, L4-5, L5-S1. Then we're going to fix the disc on the left. And Henry is going to show you guys a video explaining why discs cause pain and how we fix them. In the meantime, I want you to see he's got red, white, and blue. This is a true patriot right here.
Disc injuries start with an annular tear. Damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922. Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. We are at the L5-S1. He's got a massive tear here. Hold on. Yeah, he's wiggling a little bit. Go ahead. All right. He's got a very anterior spine, which is very difficult to do surgery on, to get in. He's got big facets, which are very difficult to get around to do the surgery. He's got a very a deep back, which I already said. You know, this is not an easy case. This is as hard as they get. But rather than give up, I want to help him get out of pain. He's been in pain for 20 years. And all right, we got to pull the dilator back a little bit. Lay still. We still put the numbing medicine in the discogram, right? Shot? No, is that it? Pull it back a little more. Shot. All right, that's better. Let's go forward again. So we had to pull the dilator back because it's advancing. We don't want it to end up the dilator in his pelvis. Yeah, you're right. So, yep. We're pretty anterior. We can pull this back a little bit. Get the fluoro out. Questions?
Next question coming from Lanu once more.
Did we show both videos?
Yes, we did. Yes, we did.
All right.
Next question from Lanu once more on YouTube, asking, the facet joint on L5 to S1 is huge.
Yes.
Is this unusual?
No, it's okay. Great question, Lanu. Facet, here's what happens, folks. The way you get a disc injury is through trauma. You get trauma to your spine. The problem is when you get trauma to the disc, you also get trauma to the facet joint at the same time. Laser. So when you move the two bones, L5 and S1, quickly, suddenly and forcefully with trauma, you not only tear the disc back wall, called the posterior tear, you also tear the facet capsule. So when that trauma happened in this gentleman many, many years ago, okay, thank you. It not just damaged the disc, but it also damaged the facet. And this is true for every single human being alive that gets spine trauma. It damages the disc and the facet. So what happens then over time, over years, is the disc, which is a joint under tremendous weight and pressure, it just starts to degenerate. It starts to break down from the process called inflammation. Now, if you could stop the inflammation, you can stop the degeneration of the disc. Okay, but if you can't stop the inflammation, you'll never stop the degeneration of the disc. So our goal here is to stop the inflammation. And people think when you look at an MRI, you see a degenerated disc. That means you've got to fuse it or clean it, take it out and put a new disc. You don't. All you got to do is stop the inflammation. And by doing a stopping of the inflammation, you literally take the back pain away that comes from the disc. You take the leg pain away that comes from that disc. And you got to unpinch the nerve if the nerve is being pinched. The nerve root, okay, to be more specific, nerve root has to be unpinched. Okay? So, there's certain goals we have to achieve with this surgery. One, see that tear right there with the blue? The blue is the herniated nucleus pulposus. Now it's staining blue because we put a special dye in the disc with the discogram. That dye will only bind to abnormal nucleus pulposus. In other words, if you have a normal disc, it will be white. There will be no blue dye staining. The blue dye will leak out and not bind to anything. The fact that the blue dye is bound in that area means that there's nucleus pulposus and that it's degenerated nucleus. In other words, normal nucleus is white. Degenerated nucleus stains blue with our blue Duke spine dye. So the fact we're seeing blue here tells me this is an area of degenerated nucleus, and the only way to get degenerated nucleus or degenerated disc disease is through inflammation. There is no other way. Now, how many people will tell you that in the world? Almost none. Why? Because they don't know that to be true. That is something we discovered at Duke Spine. The dye part was taught to me by my predecessor who taught me, Dr. Anthony Young. But the part about the disc being degenerated and causing inflammation and pain, that's what I basically figured out. It comes from my own personal experience treating patients with laser, getting rid of their back pain, but also from reading publications done by researchers who studied inflammatory effects on discs and what happens to the nucleus pulposus with inflammation. Now remember, inflammation is a normal part of your body. We all have inflammation. It's normal. A little bit of inflammation is okay. The problem is when the inflammatory system just goes crazy here and attacks the herniation and doesn't stop. Now people say, well, what if I take anti-inflammatories? Yes, that will help a little bit, but it's not going to solve the problem because anti-inflammatories are medicines that we take in by mouth usually, or injected into muscle, or injected in directly into the spine, or injected in somewhere in our body, per rectum, whatever. And those medicines go throughout your blood system to be distributed throughout your blood system. And it's the fact that they can be distributed throughout your blood system and absorbed into tissues like muscle and fat and sometimes the disc. Okay, it's those qualities of the anti-inflammatory that allow them to be distributed throughout your body that also allow them to be undistributed throughout your body and taken back up. And then when they go back into circulation, your kidneys either metabolize and get rid of them, or your liver metabolizes and get rid of them. So anti-inflammatory pills or shots, they're only temporary and they only have a temporary effect. If you want to get rid of the inflammation permanently, you must do this surgery, or you can do a fusion, okay? A fusion of this disc would work. If I did a fusion on this disc, it will get rid of his pain. I used to do fusions all the time. The problem with fusion is it's not when I do it, but when other surgeons do it, is dangerous and painful and lots of complications like blood clots, edema, pain, heart attack, stroke. I mean, lots of things, you know. Lots of bad stuff happens from fusion surgery. So why do doctors recommend fusion surgery? Because they don't know how to do this surgery, and they don't make as much money doing this surgery as they would fusions. They make a lot more money doing fusions than this surgery. So surgeons are unfortunately motivated by money, and they're never going to tell you the truth. They're going to tell you what you want to hear so that you do what they want you to do. Now, I used to do fusions all the time. We have lots of fusions that done here by me on YouTube. You can go and watch them on our channel. Just go to the playlist and look up TLIF or ACDF or PCDF. Those are all fusion surgeries. Okay, so I used to do fusions all the time, and that was because patients wanted them done. They didn't want the laser, mostly because their insurance would pay for fusions, so they would do fusions, right? They do what their insurance allows them to do. We've got to get away from that. Insurance companies are not your friends. They deny doctors recommended treatment to the tune of 850 million denials a year in America. That's according to the Wall Street Journal that just reported it 2 weeks ago. If you go and look up the Wall Street Journal's article, 850 million denials of doctor-recommended tests, treatments, every year by their health insurance companies. It's disgusting. That said, most doctors let insurance companies guide what they recommend to patients. If that's the case, the insurance companies are always going to want you to do treatment, no treatment, but if you're going to have to do any treatment, they want you to do a treatment that doesn't work. Why? Because the reality is when a treatment doesn't work, people talk about it not working. The word gets out pretty quickly, and people don't want that treatment. They refuse it. Okay? If I tell you this restaurant in your city is really bad, that they have horrible food, the food is low quality, and people get sick going there and eating, would you go to the restaurant? No. So that's what happens in healthcare. People talk about treatments and doctors, and they avoid treatments that don't work, which is smart. People should avoid treatments that are bad for them. But the insurance companies, what?
My mom found a really good restaurant because 6 of her friends in her neighborhood told her about it. Said, you got to come with me.
Yeah.
It's in Merritt Island,
Which one is it?
Florida seafood restaurant.
Oh, really?
Have you ever
Interesting.
heard of it?
I think my mom goes there, actually.
Yeah, my mom
Yeah.
said, you got to all our friends go there. Have you ever been there? I thought it was excellent.
You went?
Yeah, well,
Yeah.
my mom, yeah. She said it was a
Nice.
lot better.
That's nice. So Dr. Berndes and I were just talking about that whole word of mouth thing, you know, how people talk and share information, you know, especially with the internet today. And long story short, what I'm getting at is insurance companies will pay for things that nobody wants, because that way nobody wants it. They don't have to deny it. Okay? But the things that people want, they don't pay for. The good things, they don't pay for. They just don't. Now, sometimes you need brain surgery for a brain tumor, right? That's not elective surgery. That's emergency, and they will pay for that, because if you don't pay for brain surgery on a patient who has a brain tumor, that gets out in the news usually, and it makes the insurance company look really bad. But the insurance companies are masters of deception. They really are. It's no joke. These are especially health insurance companies. Okay, I'm not talking about house insurance or auto insurance. Okay, those guys have their issues too, but I'm not going to comment on them because I'm not an expert in those fields. What I'm an expert in is dealing with insurance companies, health insurance companies. And I know all their tricks and what they do. And they are absolute evil. If I told you all the things they do to get out of paying, it would blow you away. Right now, we are fighting with Aetna because I took Aetna patients that were all approved by Aetna. For example, I took them to our surgery center for surgery, and the patients did fantastic. And Aetna was paying the bills, and then Aetna decided, you know what? These guys are doing so good, everybody's going to want to go there and get surgery at Duke Spine. We're just going to stop paying for these surgeries. So they stopped paying. They owe millions of dollars in unpaid bills. And they decided, you know, we got to really punish these Duke Spine guys. We're going to sue them. We're going to take them into arbitration, and they never should have taken the patients to the surgery center. Well, guess what? Every one of the patients that we took had out-of-network benefits, and the surgery center is out-of-network. So they approved every single one of those surgeries. But despite that, they still want to drag us into a legal battle, and they want us to pay hundreds of thousands of dollars in legal fees. And in the end, of course, everything is determined by their crony, which is a arbitrator that they choose according to our contract. It's unbelievable. And they're not just doing it to us, they do it to a lot of people. These insurance companies have so many ways of harassing doctors and hospitals, not paying the bills, making them spend money in legal battles that are just made up shit. And it's basically weaponizing our legal system, just like other people have, right? We know about that. And punishing doctors and hospitals for taking care of patients. Okay? That's what they do. And none of this is known to the patients. The world, the sleepy world, is just blissfully ignorant of what really happens. But the good news is, every one of these fights I get into, I learn something from. And I'm going to pass that on so that in the future we don't make the same mistake of letting the insurance companies have the upper hand. And more importantly, I'm going to make everybody aware of how treacherous they are. Now, good news, I'm not the only one now talking about how bad the insurance companies are. These are health insurance companies. Because now the media is looking at this, and the world is looking at it ever since that, what's his name, Mangione, shot the United Healthcare CEO.
Luigi Mangione, yeah.
Luigi Mangione. Okay, so he has brought the world's attention to this issue. Okay, not me, him. I do not condone what he did. I would never shoot or kill anybody. I don't think that's right. But I do believe awareness is necessary. The public needs to be aware of what's happening with the insurance world. And the public needs to take action. I don't mean what he did, but the public needs to hold their insurance accountable to pay for their medical care properly so that doctors and hospitals can stay in business and take good care of patients. The truth is, there's an old saying, 90% of the work is done by 10% of the doctors or providers, okay? And that's true. 90% of surgeries are done by, 10% of the doctors, surgeons, and hospitals, okay? So what does that mean? If you're an insurance company and you realize this surgeon is draining you, you're losing profits because the surgeon is really good and all the patients are going to that surgeon, what you do is you attack the surgeon. That's what these insurance companies do. They find a way to attack the surgeon and make the surgeon pay for being good and taking care of patients. If you think I'm joking or misled, you will find out 100%. I don't make anything up. This is all real. So insurance companies target good doctors that are taking care of patients and treating patients and making them well. And it's a horrible thing that's happening. But it's happening right under your noses. And what it means for you, the public, is that when all the good doctors are gone, there won't be any good doctors. And you're going to have a really hard time getting help. getting fixed. Now, America wasn't always like this. It's the greed of these insurance companies, these health insurance companies, that have made it like this, okay? Any questions?
Yes, this next question is coming from Cool on YouTube.
Cool?
Cool.
I like it.
I know, cool name, yeah.
All right.
Asking, do most insurance companies cover this procedure?
I would say most insurance plans do not cover this procedure or any new technology, any new procedures, okay? New treatments in medicine are rarely covered by insurances. Now, this treatment's been around for 20 years. So why hasn't it been covered? Because it works. That's why. This treatment works to cure back pain. And because it works, the insurance companies don't want to cover it. That's really what it comes down to. Think about it. If word got out that this treatment worked and it was covered, the world would flood our doors. And we would be doing millions of surgeries a year because there are millions of people suffering with back pain every year that we could fix. And what would that mean for the profits of the insurance company? They would go down. I don't know if you guys understand how insurance works. They take your money every month and they get to keep it at the end of the year if they don't pay any bills. So the fewer the bills they pay, the more profit they make. That's how insurance works. It's simple. Collect your money every month, premiums, and don't pay out as little money as possible. That's their goal. That's what health insurance companies do, and it's creating a huge problem. And it's not just our procedure that isn't paid for. There are 850 million things that aren't paid for by insurance companies every year. And I got news for you. 850 million isn't all Duke laser disc repair. On. Let's go. Stop playing on that phone. Don't make me take your phone away. Huh? You have a job to do. Don't give me excuses. I need you focused here. Alrighty, almost done with this disc. Any other questions?
Yes, next question coming from Professor on YouTube.
Ah, Professor, welcome.
Asking, how much does such an operation cost today without insurance?
That's a great question. I don't do the costs, so I can't answer that for you. Everybody's surgery, we have what's called a fee schedule. A fee schedule isn't my fee schedule, but it's the fee schedule for the whole surgery center, the anesthesiologist, and the surgeon, and the office visit, and the DME. So everything is bundled. We call it a bundled charge. What does bundled mean? It means rather than you have 5 different people sending you bills, you get one bill. And that's better for patients, having one bill. Okay? So we do one bill, and that covers everything. My fees are 5% of the bill. I do know that. 90% of the bill goes to the surgery center. And my fees go to pay my staff, by the way. So I don't really get to see that money. The other 5%, besides my 5%, is the anesthesiologist. He gets 5%. Goes towards his fees. So 90% is basically the facility, the hospital, basically. All the equipment, staff, all that. Great question. All right, we're just about done. We're seeing a ton of scar tissue here, a ton of old herniation, inflammatory tissue. You saw all the pink stuff. We're just about finished now. And there's a lot of calcium. This is an old injury. Old. Great questions so far. Any others?
At this moment, no current questions.
All right. So let's show a video once again on how these discs cause pain and how we fix them.
Of course.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922. Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Shot? All right. Welcome back. You can see from our video that the reason that discs are the #1 cause of back pain is an injury that happens in the back of the disc called an annular tear, which then allows pieces of disc material to come out and get stuck inside that tear. And once they're stuck in the tear, those pieces of disc nucleus called herniations, they create inflammation, massive inflammation. And that inflammation is what causes back pain. And the inflammation never stops. It keeps going. And this guy's had it for 20 years. Well, let me just finish getting in. All right. Good. So, I always have patients ask me, all right, Dr. Duke, how do you fix my back? Oh, you need laser surgery on your disc. And then they say, well, can I do physical therapy? Sure, but that's not going to fix it. Well, can I do chiropractic? Sure, but that's not going to fix it. Can I do acupuncture? Sure, but that's not going to fix it. Can I do Tommy Copper? Sure, but that's not going to fix it. And it's always the same thing. People always want an easy way out. It's like a brain tumor. Dr. Duke, I've got a brain tumor. Can I do physical therapy? Sure, but that's not going to fix the brain tumor. Can I do cupping? Sure, but it's not going to fix the brain tumor. So people are in denial of the truth. Let go. They don't want the truth. The truth is that to get rid of your pain, you have to go through a procedure. And that procedure is the one we do here. Now, if you don't mind living in pain, or if physical therapy or shots or pills help you manage the pain to where you're able to live and function normally and you're happy with that, fine, live that way. I wouldn't get surgery. The only reason to get surgery is when you're not happy with the quality of your life because pain is ruined it, okay? That's when you have our surgery to fix it. But don't expect the pain to go away with anything else. This is a cure of disc pain. A disc pain. Now, sometimes people come here, they have their disc surgery, and they end up having other kinds of pain from other areas like the piriformis or SI, and they don't understand why their pain is there from the piriformis or SI. And the answer I showed you earlier is in that video where there are 30 different things that cause back pain. Now, some people get upset because they think that I can diagnose all the causes of their back pain even though they're not having back pain at that time that I see them. And this is where it gets interesting. To diagnose back pain, the patient must have the back pain. at the time that I'm diagnosing it. Okay, it's very important. It's not possible to diagnose a source of back pain if the patient doesn't have the back pain. That is so important. I mean, I can't even tell you. It's the most important thing in accurately diagnosing back pain. So if you come to me and you have a piriformis muscle pain, but you don't have any pain that day, and your piriformis is fine on exam because it's not inflamed that day, it's feeling pretty good, then we're not going to diagnose your back pain source. It's impossible. The only way to know where back or neck pain comes from is with the patient telling you where it's coming from. That's why I always examine my patients and ask them to take their finger and point to the area that is the worst, where they get the worst pain. That's the only way to know. And then I'd start checking other areas. Like, okay, that's your worst pain, is your disc, but what about your facets? What about your SI? What about your piriformis? So it's a process. We call it the Duke Spine Exam, and it's a process of me going through the different things that cause pain and trying to figure out if that patient has all those causes or not. Any questions?
Yes, this next question is coming from Fronathan on YouTube,
Hi, Fronathan, welcome back.
asking, are the reasons for the disc injuries known? Are the reasons for these disc injuries known? Are the percentages taken down, such as motor vehicle accident or sports injuries, etc.?
That's a great question, Fronathan. Really good question. So the answer is I don't know the answer of what is the percentages. Now this patient in particular, I can usually about 90% of the time, if I interview a patient, like let's say I figure out where their pain is coming from, right? And I sit there and I say to them, you know, when did this start? When did this first start? And they will tell me, you know, oh, it started like 10 years ago when I was lifting a box. Okay, well, how heavy was the box? It was 10 pounds. Okay, that did not do it. That did not cause the tear in your disc, I guarantee you. It's not lifting the box. But lifting the box pushed out more herniation through the tear that was already there. And that more herniation is what caused your pain because it elicited a new wave of inflammation in your annulus, and that's what you're feeling as pain. So a lot of times patients don't relay to me the traumatic injury, and they relay to me instead when their pain started, and it was like lifting something, bending, or whatever, like something kind of minor. And the reason for that is that the trauma could have been a motor vehicle accident, but they didn't have much pain afterwards. I mean, let's face it, right after a motor vehicle accident, you tear your annulus. First of all, you don't have any inflammation yet. And when you're in that car accident, you have something called the fight or flight response, where your body releases epinephrine, norepinephrine, and you also get some natural opioids, painkillers released. These are called endorphins and enkephalins. So you got all this natural painkiller release from a car accident, plus fight or flight response. So you got epinephrine, norepinephrine being released, and you're not really feeling much pain. And then, you know, maybe a few weeks later, you push out another piece and you get a wave of inflammation. Okay, well that's not when the injury happened. That's when your inflammation happened. That's when you herniated a piece out, all right, which started the inflammation. So if you ask me, in my experience of dealing with patients who have chronic back or neck pain, every single time it's always an accident that causes injury. Now, what is the accident? It could be a car accident, could be slip and fall, could be sports, like, you know, football injury or something, or a hockey injury. But the point is, it's always an accident, all right? There's always an injury, some type of injury that comes from, you know, an accidental process that the patient didn't expect to have, all right? So, is a car accident the most common? If you ask me, I would say yes, but I don't have any objective data that, you know, I did a study. Look at the inflammation right there. You guys see the pink stuff right there? That
Yes, we do.
is exactly where the pain is coming from. That is the inflammatory tissue in the annular tear right there. And that was what we have to zap away because that's where the pain nerves are that are causing his back pain. He's actually moving right now. I feel him wiggling around. No, he's okay, Dr. Berndes. You don't have to load him up because I'm literally on the painful spot and I feel him respond. So that's a good sign. That means we're getting rid of his pain. And I feel really good about that. All right. Any other questions?
At this moment, no current questions. So in the meantime, why don't we discuss about the second most common causes of back pain, which is the facets.
I think it's a great idea. Thank you, Henry.
Of course.
For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-BACK, 349-6922. Facet joint injury is a common cause of chronic back pain. The inflamed facet tear generates pain signals. The best treatment for facet joint pain is the Duke plasma rhizotomy. Inflamed facet joint pain nerves are destroyed. For more details, please visit our website or call us at 1-800-FIX-MY-BACK, 349-6922.
All right, welcome back. You can see from our video that facet joints, which are these little joints in the back of the spine, about 15 to 20% of your body weight goes through the facet joints. 85% goes through the disc. The disc certainly bears the most weight and it is the most susceptible to injury. But whenever a disc is injured, facets are injured. You can't have one, not the other. The injuries happen at the same time. They're always due to trauma, and facet injuries do not always result in pain. Okay, they do result in an injury of the capsule, but a lot of times that's painless and patients don't have pain from it. So what causes the pain is not the facet injury, it's the disc injury. We are just about done with this disc. I am literally at the outside. A lot of inflammation here, all that pink stuff. You guys see it. I'm going to try to get rid of as much as I can. Don't ask me why. People say to me, Dr. Duke, how do you know when to stop? How do you know when you have enough? There's still some there. Isn't that a problem? You're right. I mean, those are the same questions I have in my mind, but I don't have a good answer. Why? Because a lot of the treatment here that we do is based on results. And we don't have theory behind it all the time. We have some where we have an understanding of what we're doing and why we're doing it and how it's working. But sometimes we don't. So why can I leave some of this and the patient's pain is still 100% gone? I don't know. I really don't know. 20 years of doing this surgery, and I can't answer all the questions because I don't have all the answers. All I know is it works. And honestly, it's never not worked. We have never had a patient that had disc surgery like this that did not get rid of the disc pain. Now, they have other causes of pain that were not treated that they complain about, but it's not the disc. It's never the disc. Literally, I have done now over 2,500 laser surgeries on the disc, and I've done an average of 2.5 discs per surgery. So what is that? 5,000 discs, right, Henry?
Yeah.
I know math isn't your strong point.
Give or
But
take. Yeah.
I've done 5,000 discs,
A lot,
laser
yeah.
surgery on 5,000 discs. All right? And I can tell you that in 5,000 discs, doing the same thing on every single patient, it takes the pain away 100% of the time. It's never not worked. What we can't take away is pain from other areas. All right, so we got some veins right there. There is a little bit of tissue right here that it looks like fat that has become inflamed. I'm gonna zap it because I don't want that to be causing any problems. Inflamed fat. But pretty much we're done. A lot of scar tissue. These are very old herniations, very old. I would give them at least 20 years, which is how long his pain is. So his disc looks like 20 years old, injuries. We're just about done on this disc, 30 seconds and we're done. And then we're gonna move over to the left L3-4. Now L3-4 was how bad when we tested it?
I think it was 8.
9 out of 10, 9 out of 10. And concordant, meaning that's where he gets his pain every day. All right, 10 seconds, and we're done with this disc. Any other questions?
Yes, these next few questions are coming from Faisal on
Hello,
Facebook.
Faisal, welcome back.
First question asking, Doctor, how is tinnitus and headaches are related to neck pain, pinched nerves, and myopathy? Thank you.
I don't know how tinnitus is related. It's one of those things where we don't understand how people get ringing in their ears when they have a herniated disc. So I can't give you a good answer on that. Unfortunately, I don't know. But I do have some patients that have tinnitus, ringing in their ears, and that goes away after the surgery. But I would never in my career tell a patient, come get our laser surgery so we can get rid of your tinnitus. If somebody came to me and said, Dr. Duke, I'm going to have your laser surgery if you can get rid of my tinnitus, I would say, nope, don't do it. Don't do it. Yeah, because I can't promise you that's going to happen. I would not expect it to happen. I would not expect the ringing to go away with laser surgery, period. Now, does it? Sometimes, yes. Maybe 50-50. But I would never do surgery on somebody's disc in their neck to get rid of the ringing in their ears. I would not do it. And I would not let anybody on my staff do it because I don't think that's ethical to do a treatment that has a high chance of not working. Every one of my treatments, I believe, based on my experience as a neurosurgeon doing spine surgery and taking care of these patients for 28 years, I believe my surgery is going to fix their problem. If I don't, I wouldn't do the surgery. All right, any other questions from Faisal?
Yes, next question from Faisal, once more on Facebook, asking, for facet injuries, you can cut the nerve, right? Can you not laser the inflamed part of the injured facet, causing pain, sparing the nerve to be cut?
No, lasering a facet doesn't work. The only way to fix facet pain is, number one, destroying the pain nerve. Number two, taking the facet joint away and cutting it out. Is that a shot? And number three, fusing the facet joint so it doesn't move anymore. Those are the only three ways to get rid of facet joint pain, period. There's nothing else that works. So when faced with those three options, you can either plasma and destroy the pain nerve, which is called a rhizotomy, which has been the goal of many doctors for 100 years, and I'm the one who figured out how to do it. Number two, fusing. And number three, cutting the facet joint out and replacing it with a metal joint, which doesn't work, by the way. or fusing, which goes back to fusion, which would you do? I wouldn't want the cutting my joint out and having a fusion. I wouldn't want a metal joint that doesn't work. I wouldn't want a fusion. The simplest, safest, best treatment in the world for that problem is the Duke plasma rhizotomy. Go in and destroy the pain nerve to the facet joint. Shot? Any other questions?
At this moment, no current questions.
We are going to be done in 10 minutes. We're working on the last of the 3 discs. We have seen with the endoscope that these discs have been damaged for a long, long time. Shot like 20 years, easily, maybe longer. The discs are degenerated, but here's the thing. As soon as I'm done with this surgery, this next disc in 15 minutes, his disc pain will be gone. It will literally be gone. And the pain that he's had for 20 years will be gone. Okay? It will be gone. So, will he still have movement? Yes. Wait. Will he still have movement of his disc? Yes. Let's go a little more. Will he have normal function of his spine? Yes. Because we're not taking anything out. We're not cutting his muscle. We're not fusing. You felt it? Take it out. Shot. Okay. We are literally just repairing his disc. We're cleaning up the part of the disc that's damaged, that's causing all the pain. His body will heal this thing over the next year. Wait. Huh? All right. Good luck on that one. All right, good job. Luis is the man. He is the man. Any other questions?
At this moment, no current questions.
That's the miracle of this surgery. It literally cures the pain coming from the disc permanently for the rest of the patient's life. And it does it 100% of the time, in my experience. I have never seen it not work. Never. Never, not once. And that's 5,000 discs that I've treated in 20 years. That is a remarkable result. And the only way you can get 5,000 discs completely pain-free every single time, 100%, is if you're targeting the source of the pain, right? That is the reality. We have found the source of pain when people have discogenic back pain. That's back pain coming from a damaged disc, degenerated disc, bulging disc, ruptured disc, herniated disc, any kind of disc injury seen on an MRI. If the patient's pain is coming from that disc, which I can figure out with the Duke spine exam, then that pain always goes away 100% with this surgery. That's been my experience. Okay? Could I also get rid of the pain by doing a fusion of the disc? Yes. If I do my fusion, where I cut the facet joints out, called the Smith-Peterson osteotomy, I put a cage, I cleaned the disc out with a shaver, I put a cage in the disc made out of plastic, and I fill the disc up with cadaver bone and the patient's own autograft harvested locally and morselized. So I do an interbody fusion, interbody cage, remove the entire disc, and I remove the facets with an osteotomy, which you guys can watch me do these. I used to do them every week, like 3 or 4 a week. And then put in screws and rods. If I do that, I will cure this patient's disc pain. But why go through a major surgery like that if it's not necessary when we can use laser instead? That's the whole point. Less invasive, safer, faster recovery, and maybe slightly more effective with laser than it is with fusion. All right. Any questions?
At this moment, no current questions. So in the meantime, we're just seeing the endoscope, where you're going inside with the laser. And so, if anybody has any more questions before we conclude, please feel free. So.
Yeah, I'm grabbing out pieces of herniation using the metal grabber. These are loose herniation fragments. Remember, I shoved this piece of metal right into the disc. Right. When I did that, I went through the tear, that was already there. But what's in the tear? Herniation. So what I'm doing is I'm pushing those pieces of herniation that were wedged in the tear, pushing them into the disc, and I just retrieve them. See? It's called the inside-out technique. We are done in 5 minutes, 5 minutes. Now, our next patient is, I'm not going to tell you his occupation, but I'll just say he's in law enforcement. And he comes from Indiana, the great state. He's here because he's having a lot of back pain. He's a real go-getter. Very active physically, very fit, but his body has all kinds of joint problems, okay? From injuries over the years. Knees are hurting, the back is hurting. He's got disc pain, he's got facet pain, he's got piriformis pain, he's got sacroiliac joint pain. Now, he's only getting the sacroiliac joints and the piriformis is fixed today. He's going to come back later and get the other stuff fixed. All right. Just about done. Any other questions?
At this moment, no current questions.
All right. Well, there's the pink inflammatory tissue. Once again, you guys see it?
Yes, we do.
All right. That is the source of back pain. I discovered this 20 years ago, and I talked about it and published it. That is the inflammatory tissue along the tear in the annulus that causes all the back pain. And the same thing in the neck. And we can debride it, which means remove it, using a laser, like we're doing right now. It's the only way to do this. Now you can do it using a shaver, a mechanical shaver. That's what I do in fusions, where I shave it out. Please step outside next time you want to strip. That's all right. I forgive you. All right. Any other questions?
At this moment, no current questions.
Well, when there's no questions at the end, I usually will end the broadcast. But if there's lots of questions, what happens?
We go to Q&A.
Something special.
I know.
I do questions and answers face to face with you guys live, where you can get my answers and watch me drink coffee. And as my son said one day, a long time ago, he said, I dare you to eat a cheeseburger while you're answering questions. So I did. I ate a cheeseburger. That was a couple of years ago. Remember that, Henry?
That was awesome.
Yeah. I have great news, by the way. This summer, my two children will both be working here.
Yay.
Yep. They're going to learn the family business.
Excited to see Arias again. He's a good friend, and so
Yeah.
much respect, and I hope he's doing good.
Yeah, Arias is doing great. My older son, he's at Princeton University, second year, pre-med. And he just got into Ivy Eating House, which is the most prestigious eating house in Princeton. They're the most selective. Everybody wants to go to Ivy from Princeton, but he got in. Apparently he was the #1 ranked applicant this year. So I'm very proud of him. He's a incredibly gifted young man, much smarter and more capable than me. If he takes over this business, the world will be a better place. That is 100% for sure.
No current questions, so we do have a comment from Fronathan once more on YouTube
Sure.
saying you've done a good job answering all of our questions, Dr. Duke.
Thank you. Thank you very much. Yeah, I love teaching. You know, I've been a teacher for, since probably high school, helping students understand things. It's just enjoyable for me to teach other people and to see the light bulb come on, you know, when they finally get it and understand it. It's always just been I guess it's in my genes. My father was a teacher at USC in Los Angeles. He was a doctor. He was teaching at the med school, taught medical students and residents, fellows, how to do obstetrics and gynecology. And thank God I did not take an interest in that field, because if I did, we wouldn't have this surgery. We wouldn't have a pathway to cure pain in people's backs and necks. It wouldn't exist. I can tell you right now, the industry does not want you guys out of pain. The industry wants people to stay in pain so they can keep treating them and keep profiting off of them. It's disgusting. The only reason I'm different is I'm an ethical, moral person, and honestly, I went into medicine to help people get better, not keep them suffering. So the whole idea that my colleagues are keeping people suffering either directly or indirectly through industry is disgusting to me. Doctors are the most trusted people, at least they're supposed to be, by their patients, to be their advocates, their advisors. And when doctors betray their patients' trust, nothing makes me angrier. I don't mind a doctor who will say to their patients, listen, I'm here for the money. I'm going to recommend only treatments that won't fix you, but it's going to enrich me. You might feel better for a little while. Fine. Then, as long as you're honest about it, then the patients can choose who they want to treat them. But these doctors lie to the patients to get them to do the treatments that don't work. And that really makes me upset. Again, the insurance companies lie, and lie to the patients saying, we're going to give you great insurance if you pay our premium every month, and that makes me upset. I guess what bothers me the most is dishonesty. Right? If you're a dirtbag, then at least just be honest about it. Say, I'm a dirtbag, I don't care about you, I just want your money, and fuck off otherwise. Then fine. Good. But don't lie to people. Right, Dr. Berndes? All right, so thank you. So we've just finished fixing 3 discs. He's going to do fantastic. We've verified that those 3 discs are causing his typical daily back pain. He verified that with our discogram about 25 minutes, 30 minutes ago. And he's going to recover for an hour, and he's going to go home. Basically, he'll stay in the hotel tonight just so we can check him up tomorrow, and then he's going to head back to Georgia, hang out with his daughters, or Alabama, wherever he decides to go. But this is outpatient surgery. There's no hospital. There's no bleeding. Shoot, we don't even do pain meds afterwards. We give Tylenol and Robax and a muscle relaxer. That's it. Any questions?
Yes. One more question coming from D. Brosco22 on YouTube.
Hello, welcome.
Asking, what do you do for the SI joint issue?
Yeah, great question. So SI joint is the 3rd most common cause of back pain. And lots of doctors will tell you to fuse it, but fusions don't work. They've been proven to be no more effective than shots and pills. What we do works, and it's called a rhizotomy of the SI joint. Henry, why don't you show him what we do?
Of course.
Sacroiliac joint injury is a common cause of chronic back pain.